So let's talk about evidence. What is the evidence for the adipose cell fraction in osteoarthritis, or what we call stromal vascular fraction? Done almost about 106 patients. Let me tell you, we do arthroscopies and we do joint replacements, with everything, but after we've done this procedure, only 3 patients we have converted to total knee. 2 by me, 1 by another surgeon. So this, I would say, in my experience, is a very effective procedure. So let's see what are the pain scores, evidences, what are the MRI evidences, and what are the arthroscopy evidences for SVF. The pain scores. So this paper was already discussed by Dr. Wayne Thomas in his presentation. This was published in 2015. This was a study from Ukraine, Meklik and others. And they studied the SVF application in patients with osteoarthritis. And they found that in their 1128 patients with 1856 joints, spanned over 1 to 4.5 years of follow-up. They studied the KOOS score and they found no serious side effects or systemic infection or cancer. Most patients gradually improved after 3 to 12 months of treatment, and at least 75% score improvement in 63% in 1 year, and at least 50% score improvement in 91% after 1 year. Obesity and high-grade osteoarthritis were associated with slower healing or lesser scores. They again published their study in JCOT 2019, but this study was in elderly patients, and it was a multi-center controlled study. They published in 2019. There were 29 patients older than 80 years. They found no complications with processing of the adipose tissue. They found local pain and minor swelling at the site of infection observed for 1 to 2 days in 2 cases, and no long-term side effects or complications. 3 patients died 21 to 33 months after the SVF, but causes not related to SVF therapy. So just an age phenomena. They found that the semi-quantitative evaluation of pain as well as total amount of NSAID or analgesic drugs were significantly reduced from the first month of treatment. And they found significant improvement in limp at walking, joint range of motion, and joint stiffness. And this is how the pain scores reduced, and the need for analgesics also reduced. So these are the other good well-designed studies which have also been published, like this study, level 1 evidence, published in 2014, showed significant improvement in WOMAC scores at 1 year baseline. No adverse effects. Meta-analysis of 11 studies published in 2017, followed up for 24 months. Overall treatment showed to be safe, great potential as efficacious clinical therapy for patients with osteoarthritis. Again, double-blind randomized study 2018, significant improvement in different pain scores, VAS, WOMAC, ROM. Now, they also studied the quantitative and qualitative MOCART, or magnetic resonance observation of cartilage repair tissue at 6 months and 12 months, and they found slight improvement. Now we'll look at this study later. Again, a 2019 study, 18 patients, 24 months follow-up, improved VAS scores and WOMAC scores. And Jain in 2017 published in Stem Cell Translation Medicine, 30 patients, 18 months of follow-up. They combined microfracture with SVF and PRP as compared to just microfracture, and they found that the microfracture with SVF with PRP study patients group had better long-term outcomes than microfracture alone. Another study, 2017, Stem Cell Translation Medicine, published by Toy-Serkini and others, 36 studies. This was a systemic review. They found all these procedures to be safe at all places. Now, this study, published in American Journal of Sports Medicine, was a level 1 evidence. Clinical efficacy of SVF intraarticular for osteoarthritis, published by Garza and others in 2020. So this was a multi-site prospective double-blind control study from US. 39 patients were randomized to high-dose SVF, low-dose SVF or placebo. So these three groups. They scored, they analyzed the WOMAC scores and also MRI images at 6 months and 12 months after injection. The median percentage change in WOMAC at 6 months after injection for the high dose, low dose and placebo was 83%, 51% and 25% respectively. So placebo is quite low. And 1 year after injection for high dose, low dose and placebo was 89, 68 and 0%. So the placebo again reached 0 at the baseline. MRI images, they reviewed no changes in cartilage thickness after treatment. Now, I was curious about this MRI, what was which type of MRI was done. So I looked into the study. I found that this was just simple conventional MRI, not the special cartilage MRI scans. And this was Vinay and myself, we published our own study. And we analyzed the KOO scores. This was the grades of osteoarthritis, most were grade 3, 93%, 17% were grade 2. And we found significant improvement in pain, symptoms, AOL and quality of life scores. Now let us look at the MRI evidences. There are advanced MRI for articular cartilage. Now, I am not an expert in MRI, I don't know too much, but this is what I read from literature. An ideal MRI study for cartilage would evaluate the thickness, the volume and the integrity of the cartilage and provide details about the cartilage and underlying bone morphology. It will also assess the cartilage biochemistry and physiology, including collagen and proteoglycan matrices. So these are the different advanced MRIs for articular cartilage. The spin echo or SE, the gradient recalled echo or GRE sequences, fast SE, FSE and 3D SE and GRE. Don't ask me, I am not an expert, but this is what I have read from the text and literature. So we just skip this detail. This was a study published from China, intraarticular autologous SVF for osteoarthritis, and they looked at the clinical as well as the MRI findings. They studied the Mokart measurements for the changes in cartilage, and they found that the SVF treated knees showed significant improvement in the VAS scores, WOMAC scores and range of motion at 12 months. And they found that the Mokart study revealed significant improvement of articular cartilage repair in SVF treated knees as compared to the control they took was hyaluronic acid treated knees. After 1 year, as compared to the control or the hyaluronic acid treated knees, the SVF showed definite better improvement. And this is what this is from the paper. So this is what they showed. The MRI scans showed baseline, SVF treated knees at 6 months and SVF treated knees at 12 months. Complete repair and filling of defects with good integration with the adjacent cartilage and the underlying bone in coronal transverse and sagittal planes. And this is how before chondral defects, the loose chondral flaps at 6 months, SVF therapy showed reintegration of the flap and reconstitution of chondral defects with a layer of chondral overgrowth. Again, post 18 months of SVF therapy, the cartilage defects leading to the defect of subchondral bone disappeared and is covered by regenerated smooth chondral layer. Again, this paper was this is quite interesting. It's quite advanced cartilage imaging, MRI imaging. The 3D FS or fat suppressed SGPGR sequence. This was published in 2021 December, about 5 months back, from China, and they evaluated the effectiveness of SVF versus hyaluronic acid in cartilage regeneration. And the model they established was a 3D fat suppressed spoiled gradient recalled echo, 3D FS SPGR. So this is a little advanced cartilage imaging. And they divided the patients into two randomized groups. One was SVF group and one was the hyaluronic acid group. And then at baseline, then at 6 months, then at 12 months, they took these images before treatment, after treatment 6 months, and after treatment 12 months. And the cartilage was characterized into 6 regions. So, and then the clinical and radiographic scores were recorded at 6 months and 12 months. So in all regions, the thickness, the volume of cartilage defect, and the volume of healthy cartilage were improved to some extent in the test groups, especially medial femoral condyle and medial tibial condyle, but no such phenomena was observed in the control group. So SVF treated knees showed significant improvement in clinical and radiographic scores at 12 months, but in control group they became worse. And this is how they used these, they showed these images from different parts. So the medial and there was a different color coding and color masks for the different regions. The lateral femoral condyle, the medial femoral condyle, the intercondylar region, and the medial tibial condyle, lateral tibial condyle, and patella. And these were the defects, the small defects in each region. This is how they mapped them, and this is how they showed that in the test group and the control group, how the difference was to be seen in the test group after 1 year, significant improvement, whereas in control group or hyaluronic acid group, no improvement. Now let us see what are the arthroscopic evidences after SVF treatment. These are the studies. This was published in 2014, a study from China, intra-articular injection, SVF, and this is how they found cartilage regeneration from baseline to 6 months after injection, and they found that there was a thick, glossy white, firm, hyaline-like cartilage which covers majority of the cartilage defects in the medial femoral and tibial condyles. Again, another study from Korea, which was published in 2013. Second look arthroscopic findings after adipose derived SVF, and the second look was when they removed that plate of HTO. Now we were discussing in the morning about post HTO, and we just discussed the post HTO, should we inject or should we not inject? Because HTO as such gives us good results in unicompartmental OA. Itself is a good procedure. Now, what difference does it make if we combine SVF with HTO? So this is how they found that the medial femoral condyle showed, this cartilage was already shown by Dr. Wayne Thomas in the morning. The second look arthroscopy revealed that cartilage defect was completely covered in second look arthroscopy. So the conclusion, there is enough level 1 and level 2 evidence on the use of autologous adipose SVF in OA, and this is fulfilling the gap for treating grade 2 and grade 3 osteoarthritis, where HTO is an option with or without SVF, and this can be considered as the first line of treatment for joint preservation. Again, this is another study comparing HTO with PRP or with HTO with mesenchymal stem cell or stromal vascular fraction, published in 2014, and they found that at plate removal, even partial or even fibrocartilage coverage was achieved in 50% of the mesenchymal stem cell with PRP group, but only 10% of patients in the PRP group showed this result. So the conclusion about mesenchymal stem cell therapy in conjunction with HTO, mild improvement in cartilage healing, but showed good clinical results and KOOS scores and VAS scores. So this is level 2 evidence. Again, another study published, this is from Korea, published in 2018, American Journal of Sports Medicine, clinical and second look arthroscopic results, 271 patients studied for 5 years, 2009 to 2014. They scored IKDC and Lysholm scores. Second look arthroscopic cartilage regeneration was evaluated by ICRS grade, and the group that received mesenchymal stem cell injections scored better on IKDC and Lysholm scores at final follow-up than the group that did not. So these are the evidences on clinical, on arthroscopy, and on MRI. So SVF, I think, is a procedure here to stay, and it's a better option than many other procedures done alone or combined. Thank you so much.